All right, we have now the general systems model. That's number 9. General systems has always been kind of controversial within the drug and alcohol field because of the basic perspective that it has, and it's this, that maybe an individual's problem with alcohol isn't so much because there's a physiological difference, a physical difference, or emotional pain of some sort. Maybe it's the result of a dysfunction within a system. So in other words, problem drinking would be more of a symptom of a bigger problem than an individual problem by itself, not a primary problem. A very specific aspect of that is called family systems. And it would suggest that, it's difficult to get people in recovery because maybe that drinking served a function for that system. And you can think about it in terms of we say that a lot of families maybe have family scapegoats or whatever, which allows people within the family to kind of vent some of their frustration and irritability and anger and that sort of thing. And that tends to be what their role is. And it's a little bit along those lines. We have had, since the 80s, groups develop called Codependents Anonymous or Children of Alcoholics, adult children of alcoholics. And the basic idea is that because you grow up in an alcoholic home, there are these sets of behavior and perspectives and knowledge and ideas and thinking that are kind of common across the board, that people who grow up in alcoholic homes will have very similar kinds of characteristics. And you'll see lists sometimes, maybe I'll dig one up for you, but they almost always used to start with this: has to guess at what normal is. Listen, that's hardly a characteristic of children of alcoholics. I think that's most people, quite frankly, who struggle with understanding that, whatever normal happens to be, and a set of other lists that maybe aren't so accurate either. But because this perspective is so unique, treating alcohol problem as a symptom of something, the treatment and everything will be quite different as well. So under here, the examples and causal factors I've kind of mentioned already. The interventions under a systems perspective is one, family therapy of some sort, trying to bring the whole family into recovery at the same time, because it's theorized that without the family all coming together, it's going to be stressful and hard. And I can certainly verify that. After I went into treatment, it threw the whole family into an uproar, and sooner or later all of the other alcoholics wound up in treatment too, but only after a long period of time and a long period of problems, because we didn't have the availability of an entire family being treated. And of course, peer support. Thinking back on children of alcoholics and that sort of thing, people who identify with you and understand your problem. Sometimes people who are in recovery have to find alternative families, temporary families, to get that kind of support and understanding that they really need. It's not that we suggest people desert their families or anything like that. It's just that for a while, other systems may be better able to understand you, or you may fit in more comfortably with a different system for a while until your system straightens out. So intervention agents, well, family counselors, family therapists, the appropriate support group, and that sort of thing. Just being a therapist or a counselor by itself isn't qualifications for dealing with families. I mean, every family is unique, and you do need experience and understanding and knowledge to do that. So I wouldn't say that it's a terribly popular model anymore. I like systems theory myself, or I should say I like aspects of it, and I find it very useful in doing therapy with people. But in and of itself, people don't tend to like it all that much, and social work has kind of abandoned the whole idea of family systems theory